Influenza, commonly known as the flu, is a highly contagious viral infection that primarily affects the respiratory system. The history of influenza dates back centuries, with its earliest documented outbreaks occurring as far back as 400 BC, when Hippocrates described a disease resembling influenza. However, it was not until the late 19th and early 20th centuries that significant advances in the understanding of influenza emerged. The term, influenza, itself was derived from the Italian word for influence, reflecting the belief that the disease was influenced by celestial bodies. The first recorded influenza pandemic occurred in 1580, and subsequent outbreaks continued to impact populations worldwide. The major breakthrough in understanding influenza came in the early 20th century, when scientists identified the virus responsible for the disease. In 1933, British scientists Sir William Henry Welch and Sir Frederick W. Twarts successfully isolated the influenza virus from patients, marking a significant milestone in virology. Their work laid the foundation for the development of influenza vaccines and antiviral medications. Influenza viruses are classified into several types, including influenza A, B, C, and D, with influenza A and B being the primary causes of seasonal flu epidemics. The continual evolution of the virus through antigenic drift and shift makes it particularly challenging to predict and control outbreaks. Influenza is characterized by a sudden onset of symptoms, which may include fever, chills, cough, sore throat, body aches, fatigue, and headaches. The flu is transmitted primarily through respiratory droplets when an infected person coughs, sneezes, or talks. It can also spread by touching surfaces contaminated with the virus and then touching the mouth, nose, or eyes. Seasonal flu epidemics occur annually, typically during the fall and winter months, leading to significant morbidity and mortality, particularly among vulnerable populations such as the elderly, young children, and individuals with underlying health conditions. The World Health Organization, WHO, estimates that influenza results in 3 to 5 million severe cases and 290,000 to 650,000 respiratory deaths worldwide each year. Prevention and treatment of influenza focus on vaccination, antiviral medications, and supportive care. The influenza vaccine is the most effective way to reduce the risk of infection and its associated complications. Annual vaccination is recommended for everyone aged 6 months and older, particularly for high-risk groups. The vaccine is updated yearly to account for the circulating strains of the virus, as it can change significantly from season to season. Antiviral medications, such as oseltamivir, Tamiflu, and zanamivir, Relenza, can reduce the severity and duration of the illness if administered within the first 48 hours of symptom onset. These medications work by inhibiting viral replication, allowing the immune system to mount an effective response. In addition to vaccination and antiviral treatment, several supportive measures can help manage influenza symptoms and promote recovery. Staying well hydrated, getting plenty of rest, and using over-the-counter medications to alleviate fever and aches can be beneficial. Home remedies, such as warm liquids, honey, and saltwater gargles, can provide relief for sore throats and coughs. In more severe cases, particularly for individuals with underlying health conditions, hospitalization may be necessary for close monitoring and advanced supportive care. Additionally, public health measures, including promoting good hygiene practices, such as frequent hand washing and respiratory etiquette, can significantly reduce the spread of influenza within communities. Research continues to advance our understanding of influenza, with ongoing studies focused on improving vaccines and antiviral therapies. The emergence of novel strains, such as H1N1 in 2009 and avian influenza viruses, highlights the importance of global surveillance and preparedness for potential pandemics. Vaccine development efforts aim to create universal influenza vaccines that provide long-lasting immunity against multiple strains, thereby reducing the impact of seasonal flu outbreaks and the risk of future pandemics. Public health initiatives play a crucial role in educating communities about influenza prevention, promoting vaccination, and monitoring viral trends. By increasing awareness and preparedness, societies can effectively combat influenza and reduce its health burden worldwide. The complexity of influenza extends beyond its immediate symptoms and treatment options. It also poses significant public health challenges globally. Influenza viruses constantly undergo genetic changes, leading to the emergence of new strains that can evade the immune system. This phenomenon, known as antigenic drift, occurs as the virus replicates and mutates, while antigenic shift involves a more substantial genetic reassortment, often occurring when two different strains infect the same host. Such shifts can result in novel viruses that may not be recognized by the human immune system, potentially leading to pandemics. The 1918 Spanish flu pandemic, caused by an H1N1 strain, is a poignant example of how a new influenza strain can have devastating effects, infecting a third of the world's population and causing an estimated 50 million deaths. This historical context underscores the importance of vigilant surveillance and research to anticipate and respond to emerging influenza threats. The public health response to influenza involves a coordinated effort among healthcare providers, government agencies, and community organizations. National and global health authorities, including the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, play crucial roles in monitoring influenza activity and coordinating vaccination campaigns. The Global Influenza Surveillance and Response System, GISRS, facilitates the sharing of influenza virus data, which is vital for understanding viral evolution and informing vaccine composition. Public health strategies also include the development of contingency plans for pandemic preparedness, which involve stockpiling antiviral medications, establishing distribution channels for vaccines, and educating healthcare workers about the disease and its management. These efforts aim to enhance community resilience and minimize the impact of influenza outbreaks. In addition to vaccine development, ongoing research is exploring innovative therapeutic approaches for influenza treatment. New antiviral agents, including favipiravir and baloxavir marboxil, are being studied for their efficacy in reducing viral load and symptom duration. Furthermore, studies on monoclonal antibodies and host-directed therapies aim to enhance the immune response against influenza viruses. The focus on personalized medicine is also gaining traction, as researchers investigate genetic factors that influence individual responses to influenza infection and treatment. By understanding these dynamics, the medical community hopes to tailor interventions to optimize outcomes for patients, particularly those at higher risk of severe illness. The economic impact of influenza is another critical consideration, as seasonal flu epidemics can strain healthcare systems and result in significant healthcare costs. Estimates suggest that influenza-related illnesses cost billions in direct medical expenses and lost productivity each year. Public health initiatives that promote vaccination and preventive measures can alleviate some of these economic burdens. Employers, schools, and community organizations are increasingly recognizing the importance of vaccination campaigns to reduce absenteeism and improve overall health outcomes. Strategies that encourage vaccination in the workplace or through schools can foster a culture of health and well-being, ultimately benefiting the broader community. Looking to the future, the challenges posed by influenza are multifaceted and require a comprehensive approach. Continued investment in research and development is essential for advancing our understanding of influenza virology, epidemiology, and treatment. Global collaboration is crucial for sharing data, resources, and expertise, particularly in the face of emerging strains and potential pandemics. Public education campaigns aimed at dispelling myths about the flu vaccine and emphasizing the importance of vaccination can empower individuals to take proactive measures for their health. Through a combination of scientific innovation, public health initiatives, and community engagement, society can effectively combat influenza and minimize its impact on global health. Influenza's impact is not only felt in terms of individual health but also has significant social and psychological implications. During flu seasons or pandemics, public anxiety often rises, as individuals fear contracting the virus or spreading it to vulnerable family members. This fear can lead to changes in behavior, such as avoiding crowded places or neglecting social interactions, which may contribute to feelings of isolation and stress. Additionally, the psychological toll on healthcare workers during peak flu seasons can be immense, as they face increased patient loads and the emotional strain of dealing with critically ill patients. Addressing these psychological aspects is crucial for both the general public and healthcare providers, ensuring that support systems are in place to promote mental well-being during challenging times. In the context of global health, the interplay between influenza and other infectious diseases, such as COVID-19, presents unique challenges. The dual burden of these respiratory illnesses can strain healthcare systems and complicate diagnostic processes. The co-circulation of influenza and other respiratory viruses may lead to increased morbidity, making it essential for healthcare providers to differentiate between them for effective treatment and management. The COVID-19 pandemic has highlighted the importance of robust respiratory virus surveillance systems, as understanding the patterns of influenza and other respiratory pathogens is critical for public health responses. Additionally, the lessons learned from managing COVID-19 can inform future strategies for influenza preparedness, particularly in the areas of vaccination distribution and public health messaging. The role of technology in combating influenza is becoming increasingly important. Innovations in vaccine delivery, such as microneedle patches, hold promise for improving vaccination rates by making the process less invasive and more accessible. Moreover, advancements in diagnostic technologies, including rapid testing and genomic sequencing, enable quicker identification of circulating strains and facilitate timely public health interventions. The integration of artificial intelligence, AI, in predicting influenza outbreaks based on environmental and demographic data is also gaining traction. AI can analyze vast datasets to identify trends and patterns that might precede outbreaks, allowing for proactive measures to mitigate the spread of the virus. Community engagement is essential for the effective management of influenza. Local health departments often spearhead initiatives to educate the public about the importance of vaccination and preventive measures. Programs that involve schools, workplaces, and community organizations in flu vaccination campaigns can significantly enhance participation rates. Involving trusted community leaders and healthcare providers in these efforts can also help build confidence in vaccination and combat misinformation. Grassroots initiatives that promote healthy behaviors during flu season, such as hand hygiene and respiratory etiquette, are vital for reducing transmission rates and fostering a culture of health within communities. In conclusion, the fight against influenza is a dynamic and ongoing challenge that requires collaboration across various sectors, including public health, healthcare, research, and community engagement. Understanding the historical context, biological complexities, and socio-economic implications of influenza is essential for developing effective strategies to combat this pervasive virus. Continued investment in research, public health initiatives, and technological advancements will be crucial for enhancing our ability to prevent and manage influenza outbreaks. By fostering a collective commitment to public health and community resilience, society can better prepare for the challenges posed by influenza and protect the health and well-being of populations worldwide. The global burden of influenza extends beyond immediate health concerns, influencing economic stability and healthcare system resilience. During peak flu seasons, hospitals often face overwhelming patient loads, which can strain resources and lead to increased wait times for both influenza and non-influenza related medical care. This surge in demand not only affects patient outcomes but also places significant stress on healthcare workers, many of whom are already operating at capacity. Consequently, healthcare organizations must develop comprehensive flu preparedness plans, which include stockpiling essential supplies, training staff for surge capacity, and coordinating with public health agencies. By implementing proactive measures, healthcare systems can better navigate the challenges posed by seasonal influenza and ensure that they remain equipped to handle the multifaceted demands of patient care. The interplay between influenza and chronic health conditions is another critical aspect that demands attention. Individuals with chronic illnesses, such as asthma, diabetes, or heart disease, are at higher risk for severe influenza complications. This vulnerability underscores the importance of targeted vaccination efforts for these populations, as effective immunization can significantly reduce the risk of hospitalization and mortality associated with influenza. Public health campaigns should emphasize the importance of vaccination for individuals with pre-existing health conditions and educate them about the potential risks of influenza. Moreover, healthcare providers play a pivotal role in ensuring that their patients receive the flu vaccine and are informed about the importance of monitoring their health during flu season. Seasonal flu vaccination is essential, but the effectiveness of the vaccine can vary based on several factors, including the match between the vaccine strains and circulating viruses. Scientists and public health officials engage in ongoing research to improve vaccine effectiveness and develop next-generation vaccines. These efforts include exploring alternative vaccine platforms, such as mRNA technology, which has shown promise in the rapid development of effective vaccines against emerging pathogens. Researchers are also investigating universal influenza vaccines designed to provide broader and more durable protection against multiple strains, potentially reducing the need for annual vaccinations. Continued investment in vaccine research is crucial to enhance our arsenal against influenza and mitigate its impact on public health. The role of global collaboration in managing influenza cannot be overstated. International partnerships among governments, health organizations, and research institutions facilitate information sharing and resource allocation, enhancing collective preparedness for influenza outbreaks. The Global Influenza Surveillance and Response System, GISRS, exemplifies this collaborative effort, enabling real-time monitoring of influenza activity and facilitating the rapid exchange of data about viral strains. This global network allows countries to respond effectively to emerging threats and ensures that vaccines are developed and distributed based on the most current epidemiological information. Strengthening these international partnerships is vital for fostering resilience against influenza and other infectious diseases in an increasingly interconnected world. Finally, education and public awareness are critical components of effective influenza management. Misinformation about influenza and vaccination can undermine public health efforts, leading to lower vaccination rates and increased susceptibility to the virus. Public health campaigns that provide clear, evidence-based information about the importance of vaccination, the nature of influenza, and the measures individuals can take to protect themselves and their communities are essential. Engaging communities through social media, public forums, and educational materials can help dispel myths and encourage proactive health behaviors. By fostering a well-informed public, we can enhance vaccination uptake, reduce transmission rates, and ultimately mitigate the impact of influenza on society. The ongoing battle against influenza illustrates the need for a comprehensive, multifaceted approach to public health. Understanding the complexities of influenza, its historical significance, biological characteristics, and socio-economic impacts, allows for informed strategies that can effectively address its challenges. Through continued research, global collaboration, and community engagement, we can enhance our preparedness for seasonal influenza and future pandemics, ultimately safeguarding the health and well-being of populations worldwide. The lessons learned from managing influenza can also inform responses to emerging infectious diseases, ensuring that we remain vigilant and proactive in protecting public health.